unit within the Office of Main Care Services. We are convening a group today to come share with you a lot of the different exciting and really helpful work that's going around across Maine regarding the community health worker workforce and the Primary Care Plus program, and how those two are both going through a lot of growth and development. And there's this hope and goal and design that together those partnerships can really help improve the health of Mainers and the quality of the experience, right? Not just for people who receive community health worker services, but for community health workers, for the organizations that employ them, for the primary care providers who are able to be more effective through a team-based model. So really, there's just a lot of work going on to make this work in Maine. And the focus of today is really on hearing more about the resources, the work in general, not so much focused on Maine Care specifically, or any one policy specifically, but really broadly, what could we all be doing? Want to make sure we're seeing the different pieces of this puzzle come together and have some time to share together. So we'll open up the slides for a second. I'll walk you through the agenda, and there will be some polling done so we can get to know who's in the room, and also some small group discussions at the end, so that part of today can also be relationship building among all of us. So, oh, there we go. All right. Thank you, Loretta. Few housekeeping things before we get in. I always skip those. We're mostly going to use the chat function for questions and answers. There will be a few times where we'll pause for question and answers. And then again, there's a small group discussion at the end, but please do use the chat throughout. We will post the PDF of all of these slides that you're seeing today together after this event. And that will be go out through a Maine Care e-message, I believe, the same one that you used to sign up for this. Perhaps, I believe that's the main mechanism to get the slides out if we don't have a chance to post them in the chat during this session. And then anything that we can't answer, we'll make sure we connect with you to save that question for follow-up afterwards. So we're going to have just real quick level setting at the beginning of this conversation, where Ben Hummel is going to just give a brief overview of the community health worker profession. And then Loretta Dutil from Maine Care will give a brief overview of Primary Care Plus. But again, the focus of today is really on the third item, our wonderful guest speakers who are sharing about the work that they're doing in the state, all again, which by design, but also by fortunate circumstance, all are helping us get to the place we want to be with these partnerships that we're building and the workforce that we're trying to sustain and bolster on all fronts. We will then again close with some next steps, follow-up discussions. So first poll for today, and I realize Angelica is really busy because there's a lot of people still coming into the waiting room, so I'll take over letting people in the waiting room, out of the waiting room. But we have a question for who is in attendance today? What do you consider your main affiliation, if any? Great. Fast responses. All right. Oh, I guess I can end this poll myself. Oh, there we go. Can everyone see that? Can others see the screen? I'm just checking that.
Looks good.
Okay.
Yep.
So a lot of primary care practices, community-based organizations, community health workers, 7 people from local public health departments, and others, which could be anything else that's not identified elsewhere. So that is great. So now we can already, build relationships by just having a diverse group of people attending the call. And I will hand it over to Ben Hummel for the next part of this presentation.
Yeah, well, welcome again, everybody. It's a pleasure to be here with you today. My name is Ben Hummel. I work at Maine CDC's Diabetes and Cardiovascular Program, where I have a focus on community health workers. And I'll be getting us started today with some basic level setting about the CHW profession. So we can move to the next slide if that's possible. And we can move to the next one as well. So we wanted to get started just with providing a basic definition for community health workers. This definition is currently included in Maine Care Benefits Manual within the Primary Care Plus section. We can go back to the definition slide. So CHWs have existed in communities in the United States and around the world for a long, long time. They're not necessarily new, but we've really only begun to define them in healthcare and public health in the last few decades within this country. So the definition that Maine Care has adopted for the profession was developed by a group of CHW and allies as part of a CMS grant about 10 years ago, and it has been endorsed by Maine CHW Initiative. If we could turn back to that, that would be great. Just a few slides prior to this. Some of the key concepts within the definition are that CHWs have a close understanding of the community that they work with, which could be shared identity, culture, values, language, life experience, a health condition, or some combination of those characteristics. And that close understanding allows the CHW to gain the respect and the trust of those that they serve. And it also allows them to act as a bridge between systems and individuals. It's also important to point out some of the differences between CHWs and other types of health professionals. So they're hired for their understanding and connection to the communities they serve. This needs to be a primary consideration and not an afterthought for employers and organizations. CHWs are also most effective when they can engage with individuals in community settings and they have access to the patient's environment. So they get a full picture of the different factors that impact an individual's health and well-being. And in addition to the bullets on the slide, I would also add that CHWs typically relate to community members as peers rather than viewing them as strictly as patients or clients. And while some nurses, social workers, and foreign trained professionals choose to work as CHWs, most do not hold a license in a clinical profession. So we can move to the next slide. Community health worker is also an umbrella term. The National Association for Community Health Workers found at least 97 professional titles were in use as part of a recent survey that they did of the workforce nationally. So it's a big field, it's diverse, it's inclusive. This slide lists several examples of some of the more common titles that NACHWA was able to identify. In addition to some of the ones that are listed on the slide here, in some parts of Maine, we often hear community health outreach worker or CHOW being used as well. Maine does not yet have certification for CHWs, so therefore it usually falls to individuals and organizations to determine who's affiliated with the title or who's using the title. I have included a link to a new occupational handbook about CHWs that the Bureau of Labor Statistics has developed, which might be helpful for organizations as they're determining, whether it's appropriate to classify their employees as CHWs. I've also included a link to a document developed by NACHWA called The 6 Pillars that expands on the identity and history of CHWs further and offers more nuance than can be captured just in kind of one definition. So we can move to the next slide. Important to our understanding of CHWs is also their scope of practice. The CHW Core Consensus Project, or C3 project, is a national coalition that's seeking agreement on the scope of work for CHWs, and they've proposed the roles on this slide, which have been embraced as best practice. A CHW may not use all of these roles as part of any given position, but we do encourage organizations to consider the full potential of the CHW when they're creating positions. And you can read kind of the full description of the roles on the C3 webpage with the link that's provided in this slide. We can move to the next slide. The C3 project has also developed a set of competencies that serve as the foundation for training in Maine and across the country. And the Maine Care Benefits Manual does include language that CHWs will receive training on the competencies that have been defined by the C3 project. So a little bit later in the call, we will be hearing from MCD, which does provide a core competency training that many organizations and state use. It's important to reiterate that there is not a certification or registration process that exists in Maine. The language in the benefits manual and that you see on this slide is to ensure that PCPlus aligns with any future system that might be created, but it currently does not exist at this point in time. So that's pretty much my kind of starting place or overview. And I will hand it over to Loretta now to get a little deeper into where CHWs fit within Primary Care Plus.
Great, thank you very much. Good afternoon, everyone. My name is Loretta Dutel. I'm the Operations Manager for the Delivery System Reform Unit here at Maine Care Services. Oops. And my apologies for my slide here. Working through it. Right. So I just want to give you a brief overview of Primary Care Plus. So Primary Care Plus started back in July 2022. It's amazing that we're already a year and a half into it, almost rolling into 2 years. So Primary Care Plus is an alternative payment model, which is essentially a payment that uses financial incentives to raise the quality of care, improve health outcomes, as well as lower costs for patients, including purchasers, payers, and other providers. So this kind of gives you an overview of how Primary Care Plus is structured within Medicare. So Primary Care Plus is essentially a practice that provides a whole person approach to care to members, and they receive a population-based payment monthly, and it is adjusted by practice quality performance. And the goal of this is to incentivize meaningful practice changes. So incentivizing practices to make meaningful changes within their practices, improve healthcare outcomes, as well as team-based approach to care. So the way it's structured is that there are essentially three tiers. Essentially 3 tiers, and each tier there are requirements that practices must meet, and each tier provides a reimbursement that is a higher level as you go up each tier. And this kind of gives you an overview of the practice makeup of the primary care practices. You'll see that there are essentially, majority of them are primary care family practices, but there are a fair amount of pediatric only practices as well as internal medicine practices. I do also want to note that there is a application process for practices to enroll in PCPlus each year, and that actually is coming up this year. Each year we enroll as of July of each year, so that's why you notice that there's a July 1st date for the enrollment. So one of the goals of PCPlus is to help build the sustainable community health worker workforce, especially through the partnerships with community-based organizations. So the way we did it as a phased-in approach. So beginning with the beginning of PCPlus, July of 2022, the requirements for practices who are in tier 2 and tier 3 level of PCPlus was to complete a community health worker environmental scan that kind of goes over, what the practice demographics are, how they're currently partnering with community health workers, and then also kind of looking at the assessments as to whether they're prepared for the integration with community health worker services. And then as of April 2024, the requirement is going to be that practices within Tier 2 and Tier 3 are going to have to either directly offer community-based services within their practice or through partnerships. And there were some assumptions that we made when we first rolled out PCPlus related to community health workers. And I'll be covering those in the next slide, just to kind of give you a high level of what was included in it. So these were some of the assumptions that was included. We assumed that 5% of main care members will utilize community health worker services, an average of 40 minutes per week per member. And then you also notice the wage rate there. And so where we are today is currently about 170 primary care practices meet the level 2 and level 3 requirements. So that's about 3/4 of primary care practices, primary care plus practices that meet that. And next step is that main care is going to be further looking at adjusting the reimbursement structure of PCPlus to move towards to move away from fee-for-service and to more look closely at the community health worker services that are currently being offered. One of the things that we're doing is we're contracting with a vendor to look at the rate determination for PCPlus. So moving towards value-based purchasing model. So this gives us a timeline of what to expect within the next 6 months to a year. This portion kind of talks about what happened within the last year. So one of the things that we did, University of Maine did some research overall around community health worker workforce and also included PCPlus as part of that research. There has been some learning opportunities both for community health workers. Also, there's ongoing assistance for PCPlus practices that we hold at least quarterly within the year, PCPlus office hours. And then our goal is April 2024, we will start re-enrollment of PCPlus practices. And this is where we'll be looking at whether how practices meet the community health worker requirement. Throughout 2024, we will be working with finalizing the contract with our vendor. One of the things that they will be doing is doing a comprehensive review of the community health worker reimbursement, working with community health workers, CBOs. We're also going to be establishing community health worker consultant group as well to help support the work that the vendor will be doing. And then finally, in 2025, we will be looking to the vendor to propose and make recommendations for the phase 2 part of PCPlus model. This kind of just gives you an overview of what the requirement is for PCPlus providers for the Tier 2 and Tier 3 practices. And I had mentioned it a little bit before. It's really either hiring or contracting with a community-based organization for the community health worker service. And this just kind of gives you an example of some of the questions that we may ask primary care plus providers in the next round of PCPlus applications. And really the goal is to gather information on how primary care plus practices are utilizing their community health worker within their practice, And this will give us information to help understand how we're utilizing CHWs, as well as help inform the rate as we start looking at that more. All right, I'll pause to see if there are any questions before I turn it back over to Ben.
Okay.
Seeing none.
Yeah. Well, and if folks can also put questions in the chat during the course of the webinar if they are coming up for you a little bit later in the call. Does look like there's one listed there. Loretta, do you want to respond to that kind of via chat, and we can move into the partner sharing section?
And I actually think that's one that's going to be answered by the Community Health Worker Initiative, I believe, a little bit later in the call, right, Ben?
Yeah, I think there's resources that the CHW initiative has developed that might be helpful for that purpose. So yeah, on that note, I think let's transition over to our speakers, and I'm also happy to kind of plug in a follow-up response there as needed. So for the next part of the webinar, we've invited 3 different programs to present on the training, resources, and technical assistance that they provide for CHWs and organizations. We want practices and CBOs and other types of CHW employers to be aware of the ways that these partner organizations can support you as you plan to employ or partner with CHWs to serve main care members. So first, I'm going to invite Christina Leal and Valerie Jackson from MCD Global Health to present on the CHW training and apprenticeship program that they oversee. And I will let them take it from here.
Thank you, Ben. And thank you, everyone, for being here and being interested in learning more about the resources that are out there. We're certainly very happy to be able to be part of this presentation and being able to work closely with the state to offer the resources. And so MCD Global is a public health nonprofit organization that we have programs globally, and today we'll focus on our U.S. Programs. And so we MCD is part of the national efforts to expand the CHW workforce. And specifically, we have a focus with the state of Maine in training new CHWs or providing more skills to the existing CHWs. And we do this by partnering with community agencies, health entities as well, to provide the CHW core competency training. With specifically, we have a HRSA grant that is currently allowing us to provide these trainings free for organizations. And I'll go into detail in the next slide of what the core competency consist of, but I want to talk about in a high level what are all the opportunities that we offer in terms of trainings. And so if we can click next, we also we offer additional upskill training, so after the core competency, we stay connected with CHWs, any new trainings that come along. For example, we have for 2024, we have CHW supervision training, and this is for we know that the CHW role is very unique, and so it also needs a unique way of supervision, and so we offer those trainings. We also have CHW facilitation training that we're rolling out at the end of or the second half of this year. This is for CHWs that are holding group sessions, that are holding community meetings, or any type of facilitation that is happening. We will be giving this upskill for, this is an advanced training for CHWs. And then we continuously add new trainings to our health related topics catalog. And those are all through our e-learning opportunities. We also have the main AHEC, AHEC and UNE Scholars Program, which provides CHWs an opportunity to be part of a educational setting and interprofessional learning with other health professionals. This is a really great opportunity for CHWs to take on a leadership role within a traditional academic background. It really allows that it recognizes the uniqueness of that CHWs bring and contribute to public health. And so they're able to learn about rural health issues and ways to solve it, working as an integrated care team. And so we have that opportunity. And then we're really excited about the CHW apprenticeship opportunity that we just launched last year, and we are currently still in the process of recruiting, and my colleague Valerie will go over in detail what this means, but we are really excited to offer this opportunity as well, because it helps us work specifically with employers that need CHWs, that want to understand the CHW role. And it gives CHWs a way to get a Department of Labor certification. This is more of the high level. We'll go into more details, but I wanted to give you all the snapshot of the different opportunities that we have. We can click the next slide. So for our core competency training, I want to say that it's self-paced and it's 80 hours. And what we offer is those CHW foundations that CHWs need to be able to carry out their role. There's a health competencies component, which is the health literacy, right? We know that CHWs are connectors between the community and the health systems. And so we prepare CHWs to be ready to have a general knowledge. We also have part of the 80-hour certificate is 40 hours of field experience. And so this allows CHWs to be able to acquire this practical experience, right? They get to shadow experience CHWs. Whether if CHWs are already working in a CHW role, then they can use those hours to expand their knowledge and practice their skills. But we also have some MCD partnered sites where if an individual is wanting to come into this workforce, we provide the field experience for them, the field experience opportunities. I do want to mention that our students can be with a clinical background or a health background working in a clinic. But we also have students that are working out in the community with community-based and grassroots organizations. We also have students that come in from that they don't have any background and they're just wanting to join this health and public health workforce. And so it's we take any individuals that are interested into coming into the CHW workforce. And we have some pictures here on the types of hands-on training that our students do in their field experience, whether it be, connecting asylum seeking families to resources, learning a new skill, helping out in the shelters and passing out food. And so if we can go to the next slide. I want to talk about the core competency and it being self-paced. So CHWs have an opportunity to create a training account in our dashboard, and they are able to access the modules at their own pace. At the same time, we also have live sessions that happen weekly while the 8 weeks that they are taking the training. And so everything that the student learns on their own, self-paced, we get to practice in that live session. And so my colleague Valerie Jackson here is our lead trainer. And so if some of you are joining us that have our CHWs and have taken the training, very well about the structure that we have. And so there is a portal that continuously connects CHWs to training and keeps them updated. There's the self-paced modules, and then there's learning resources every week that they get to take. An advantage to this is that they always get to keep a membership or into their training website. So even if it's been months since they took the training and they want to go back and relearn some of the, or review some of the objectives that they learned, they're able to do that. And then if we can click again, and here's just an example of some of the CHWs that have gone through our training. Many of them go into community leader roles, and they're speaking on behalf of the CHW workforce. Our training program, trains and connects people to the different resources and different systems that are in place. And so we're really happy to be able to carry out this work. And I'll hand it over to Valerie now.
Thanks, Christina. Yeah, it's awesome to see so many former students here. So I'm going to talk to you for a little bit and give you a high-level overview of our apprenticeship program. As you heard from Ben, the state of Maine does not have a certificate for CHWs currently. And when you hear me mention certification, it is a Department of Labor certificate for earning a certificate as an apprenticeship, completed your apprenticeship training as a CHW. And that program follows any other guidelines and rules around apprenticeship programs. However, MCD is the first and only CHW apprenticeship in Maine, and we're really proud of that. So in this role, we are what's known as the intermediary sponsor. So because we don't hire apprentices ourselves, we work with employer sponsors to help you offer an apprenticeship program to CHWs to provide on-the-job training and competency-based learning. We provide supports, stipends to the apprenticeship trainees. We provide up 144 hours of related technical instruction. I'll go into that in a minute. And we provide support to the organization for providing that on-the-job training, mentoring, and in the apprenticeship realm, it's called journey worker. So a journey worker and mentor is an interchangeable word. Upon completion of this program, which includes demonstration of competencies, again, going back to what Ben said, these are aligned with the C3 project, the core CHW core consensus, as well as the core competencies students learn as they take our core competency training or a core competency training. They will earn a journey worker status. So they now, instead of being a trainee, have earned that status. So an example of on-the-job training or on-the-job learning, and this is where I love that some standardization comes in, and what the word Ben used is really optimizing the full potential of a CHW role. And over this last year, as we've been talking to partners, including CBOs, including federally qualified health centers, other organizations that employ CHWs, one of the things we learned is those 97 different roles that we can see CHWs do, they're all different in different contexts of care. But what we know is that we wanted to develop a program where CHWs are exposed to on-the-job training that will allow them to realize their full potential in a CHW role. And so our schedule of work in developing competencies are in the 15 areas. When we say it can take 6 to 18 months to develop competencies in this area, and MCD works with the employer to see, are you able to teach those apprentices that competency in this area? And if not, we'll find a partner who can. And so your CHW will get that level of training. And so these are areas that are out there that we feel are important. And then again, we know that sometimes you may have a CHW that may have demonstrated competency in that area when you hired them. And so we can work with you to look at what do you have for record keeping that shows that, and how do we accommodate you and your apprentice to demonstrate that a competency was achieved prior. These are all skills that we know are important for a CHW to recognize their full potential in different contexts of care. And then an example of related technical instruction. Again, all of these classes, because of our funding, because of the program, we can offer free to apprentices. And we're able to provide stipends and supports for apprentices to take this training so that they can earn while they're learning. And so, again, they have 144 hours that they need to complete. But as Christina just mentioned, once they graduate our core competency program and the field experience, they'll already have 80 of those hours under their belt. That's the core competency class over 8 weeks, plus the field experience, plus that health-related training that Christina mentioned. Over and above that, so that would leave them 80 minus 74 hours. They then select from a menu of courses. Which ones are important to them? We'd work with their employer and their mentor or journey worker. In your context of care, which is important that you take. Maybe there's some that you already took during on the job, so we'll work with you to decide what other ones are out there. We also know that some other classes that we may offer or that you may see are of interest, and you as an employer think this is important. We can work with you to determine if that meets the needs and get some approval on that and meet your needs for meeting that 144 hours for your apprentice. Again, if there was prior learning, you think it's relevant and we can look at it together and come to that agreement, we will go to DOL to get that considered. And then finally, I just want to kind of highlight the benefits and the multi-benefits that we're talking about. So for apprentices, one of the things we know is that, of course, developing core competency comes in here. Earning while learning on the job, as Christina mentioned, what we envision is a pipeline for folks that are coming out of, maybe there are folks graduating now. We have a huge workforce needs, as we know, and we need people getting into this role. And there are lots of folks that I know that may be graduating school now that meet the requirements to do this work, that are not interested in pursuing a secondary degree, but are invested in their communities, that know their communities, that are ready and ripe for this training. And so if we can start getting them involved and put into this training, what a great way to get folks in the workforce. Personally, I'm passionate about older workforce, people in the workforce that I think, again, may be really involved in their communities now and don't even know that this is a role that they could pursue. So getting specialized skill for employees, getting the customized technical instruction that meets the needs for them and their employer, and getting a nationally recognized portable credential is great for now. And it kind of sets them apart from other CHWs that maybe are in the field. And again, we want this opportunity for everyone. For employers, workforce. Our commitment is to expand the CHW workforce through training and other opportunities. The apprenticeship program, as we mentioned, and I just mentioned, we can customize that as needed. The funding, to support the funding for the training needs, and that formalized approach. So again, knowing that any CHW that comes through the apprenticeship program is going to be held accountable for demonstrating competency in certain areas, and that's across the board. The thing that for me is really important as a leader is the turnover costs. So we know that retention is enhanced when someone comes through an apprenticeship program because they learn with you, they're invested in you as an employer, and you've trained them on your ways, but also enhance that with ongoing professional development. And that the studies and surveys show that $1.47 is a return on investment for every dollar invested. And we're supporting employers with that investment. And most of all, just to wrap this up, what does it do for Maine? So of course, we're going to develop highly trained workers, highly trained and educated. This is driven by employer demand. Once we get you registered as an employer site, anytime you connected with the Jobs in Maine site, so and the Maine job link. So we go on there, employers link, employees link that they're looking, and there's an automatic matching happening. We get a customized long-term solution to the workforce opportunities as workers retire. And then we can connect as workforce folks, Department of Labor, trainers, FQHCs, payers. How do we all connect to address this problem together? Christina and I remain invested and dedicated to provide the training and supports to help us all elevate this role and continue to meet the needs of our people in Maine and the communities we serve. We're here to answer any questions you have now, or reach out to us at any time, and we'd love to talk to you further.
Well, thank you, Valerie and Christina, so much for presenting. It's great information. We have time for just a few questions here from participants, so feel free to come off mute or post those in the chat. And we can pause here for a second to see if we have any that come in. It looks like Linda Thomas has a hand raised. We'll go to her first.
Thank you. I do have a question about who are the employers for large part? Are they large medical practices? Are there smaller medical practices? And then I had a second question about have you experienced any tension between CHWs at some of the larger practices and the designated social workers? I'm always interested to see how those two very different positions meld together.
Thank you, Melinda. So the answer to your first question is yes, all of the above. So potential employers, which is why we have spent a considerable amount of time kind of reworking our program, because we needed to make sure that this formalized approach meets the needs of all different contexts. So our program for apprenticeship needs to meet the needs of a community-based organization that may be primarily grant funded, as well as a large healthcare system that may have other income, other resource streams. And so knowing that a community health worker fits in both. And so how does our program be one size fits all, understanding that we also need to customize for different contexts of care? And as far as tensions around, you said social workers, I would say there's a point of curiosity and learning around what's the difference between a care manager and a community health worker, or a navigator and a community health worker. And again, we go back to both Ben's definition that we're looking at, and really this is all new as we are looking at this from a higher level view of what, in thinking about PCPlus, since this is the context what we're here for today. What are the guidelines around this program, and what is it that sets a community health worker apart from a social worker? And one of the lines in the initial description that I saw today that was really highlighted and italicized was outreach is a central component of most of this work. And I would go back to Ben if you want to comment on that, Ben.
Yeah, no, I appreciate you highlighting that, Valerie. I do want to keep things moving here. I think what I will say is we will be, you'll see in a later slide, we are going to be plugging a webinar that is actually going to be happening this Thursday about community health workers within healthcare teams. And we actually unpack that topic around differentiating the CHW role from other types of healthcare professionals on the care team a lot more as part of that session. So I'd encourage people to check that out. I see Melissa Hoskins has a hand raised, so I think you'll be our final question for now for this section, but feel free to come off mute.
Thank you. I just love that community health workers are being talked about. So I have two screens. So when I'm looking at you, I'm actually looking away from you. I think this is such an important role, and I do struggle to use these folks well because I work primarily with non-English speaking folks, and I find that budgets for interpretation are non-existent. So I always manage to finagle a bagel somewhere, but funding that I don't know about.
Are you asking about funding for interpreter services, Melissa?
Yeah, specifically when like folks are not doing a main care funded service. So like at a doctor's appointment or something, that's no problem. But when they're just doing outreach, any of those initial calls or trying to follow up, if someone's not main care eligible, like how other folks are managing that.
That's a really good question. Valerie, is that something you feel like you'd want to speak to, or would it be better? We could also happy to pass that over to Olivia and Loretta as well to see if they have thinking around that in terms of kind of what compensation, reimbursement models currently look like through main care for interpreter services. So
even not, because I know community health workers don't just have to work with main care folks. So it's more even the non-main care people that I really, really want to try to target with community outreach workers or health workers, because they're the ones at highest risk. So I don't want to take up too much time. I know you're trying to move it along, Ben, but that's something that comes up for me a lot. So I wanted to throw it out there.
Yeah, I think that's a great question. I think that we should put this on the list for our future discussion, because again, I'm from main care. I don't know a lot about non-main care funding for interpreter services myself. So I think that's a great point, though, and clearly a key part of the overall connection. So we'll write that down for a future topic. I'm sure there's folks on the call who have solutions too. So I would encourage people to put those in the chat or talk to Melissa, and then also in a small group discussion if you have other resources to help out with that question, to share those then.
I'm also acknowledging there's a question here from Barbara Ginley in the chat, and I don't think we'll have an opportunity to answer it right now. I think we'll move into our next presentation, though I do encourage Loretta and Olivia to kind of follow up in response to that kind of as we progress with the call. So now I'd like to turn it over to Axel Sumuntu from the Maine Community Health Worker Initiative to speak about the ways that the statewide CHW network supports and engages with those who are working in the field. So Axel, I'll turn it over to you.
Thank you so much, Ben. Hi, everyone. My name is Axel Samunto. I work for Maine CHW Initiative as a outreach and coordinator. Could you go in the next slide? So today I will talk with you a little bit about Maine CHW Initiative, who is a statewide network that supports the workforce for over decades by providing training, support, and advocacy to workforce. And then if you look at this great slide, we have a big picture here. It was during our awareness week last year, and then our special guest was the Governor Janet Mills. And what are CHW? Here we know CHW is a professional who understands the community. Also, the CHW is a person who build relationship between community and different organizations according to the need of community. In addition to that, we know CHW improve the health outcome of our population. In short, the CHW profession is stand on 3 stones. The first stone is community. The second one is a trust and the relationship. To be a CHW, you must be a trust person. When you're in your community, they need to give like the faith. They know this person could be trusted. And then you need to have a good relationship with all your community member you serve. Could you just go in the next slide? And Main Initiative is led by 11 staff. We have 9 advisor board, who is a CHW and CHW ally. And we have 2 staff who run the initiative day by day. And the 9th advisor, their role is to direct a decision, to lead strategic plan, to build consensus, to engage stakeholder and advocate for the profession. And then that CHW advisor member is spread in our state. Is not just in one place. They are in north, in south, and in mid, in central of our state. For the 2 staff, the one is in charge of outreach and training, who is Axel Samunto, and the second one is a capacity building coordinator, my colleague Bridget Gemely. She's not here, she's in vacation. Could you just go in the next slide? So the Main Initiative our advisor and staff have created 3 committees to advance the workforce and initiative. And in that 3 committee, it's led by one of the advisor member, and they have other member who is like all community member and ally. And in each committee, we have a staff support who is one of us in our community, and outreach, Axel Samuntu. We have another one in workforce and development who is Bridget Jameli, and policy advocacy with Ben, who is right now with us online. And in this committee, we already start our work, and we will invite you. If you have a time, you could just join. But to join a committee, it's every 6 months. And then when we renew a new member. But if you are interested, you could just go in our website and you could learn more about. Could you just go in the next slide? So here, I think it's why we are here. What is the role of MenCH initiative? MenCH initiative provide resource and support to community health worker and ally. Which kind of resource we provide? The first one, each month at the 4th Tuesday, start 1:30 to 3, we held a meeting where we group all CHW and ally. Without that, beside of that meeting, we have another meeting we call a peer-to-peer support group. This meeting is held only for CHW, and there we talk everything about CHW, what challenge we have, and all of the stuff it's concerned only CHW, we talk there. And close of that, we have our monthly newsletter, who just go out every Tuesday of the month. And there we have all information who concern what we did during a month, our activity and everything. To be more like broad and to touch everywhere and to recruit new CHW member, every Friday we send an email with posting who just regard CHW. If you want to join our CHW profession, we send the posting of job, what we receive for different employee who is registered in our employee directory. And then we offer training and webinar to our CHW member and to the member of main initiative, not just CHW and ally too. Also, we have our CHW Director of Organization. Could you go in the next slide? And there we'll talk more and try to answer the question of Deborah Gray. Here we have our Director of Organization. And when you look at that, it's all organizations who already register in our main CHW Director of Organization. The North organization we do have, it's Aroostook Country, it's in Fauquet. And the South organization we already registered, it's a youth county community action who is in Sanford. But in the middle, we do have more organization. It's more than 40 organizations right now, but we will invite you to join our organization. We have small steps to be registered. The first one, you need to go in our website, maininitiative.org. And then there, you need to navigate through resource and support section. When you open that small menu, it will give you a form. That form have 2 kinds of questions. The first question it will ask you, is your organization hire CHW? If you just click no, it will let you know this is only for CHW. But if you click yes and you hire or you prepare to hire in the future CHW, it will give you a form. And in that form, you will answer the question and you will enter all data we will need to post in our map of Maine. And if someone come to visit our website, he will find your organization and he will know, hey, this organization, hire CHW. And then what is the benefit of register in this Director of Organization? I want to highlight a benefit. We have 4 major benefits that I want to highlight. The first one, as an organization, when you are registered in our directory of organization, dictionary, you will be connected to our network, like the main initiative network. All organization who is inside main initiative, you will be connected to that organization. The second one, you will receive information from the workforce committee. Everything we are doing in our organization, meeting, everything, you will receive the update. And then the third one, you could share, because you are looking to hire a CHW and you did not an extensive network. If you come in our network, or you are registered in our network, you will have a chance to touch everyone here in state of Maine, by north to south, east to west. And you could just hire and found easily someone who could be hired in your organization. And the last advantage or benefit, it's good to show your support to CHW and then main initiative. Also, it's better for our CHW to know who we partner with. For Deborah question, if you want to know, they already have an organization who already registered the CHW, I will say yes. Main CHW is one of the organization who is a big platform or group all organization inside, and then register organization who want to hire CHW or who plan to hire CHW in the future. Next slide, please. So here it's the call. I want to say, if you want to, if you feel comfortable and you want to join our group, this is what we provide. We provide resource and support, network, training and opportunity. And then for all who just work with community, who work with aging people, who work with everything who touch in our community, food pantry, transportation, housing, billing, immigration, this is your platform. You could just come, email us in info@menchw.org or by my own email. I try to go very quick to have a time to answer all questions about if you have a question. Thank you so much for your attention, and then I'm open. Next slide.
Yeah, thank you so much, Excel, for providing all of that great information. And as you said, we'll open it up now to see if there are a few questions here that folks might have about the Maine CHW initiative. And I see there is a question here in the chat from Lisa Tappert, which is, are the apprenticeship sites listed on the directory? Do you want to answer that, Axel?
Yeah, about the apprenticeship, till right now, we do have just only MCD, who is the agency who provide the apprenticeship. But with the update of list, I think we will contact and then try to put to include all organization inside. But for more accurate answer, I think Valerie is in good fit to add to my answer. Valerie?
I think that's a great idea. I'm not sure, I think that would be a great idea to add them there. They'll also be on the main job link.
And it looks like we also have a hand raised from Hamda. Would you like to share a question with Excel, Hamda?
Yes, when you stated the CHW training opportunities, is that helping the CHWs just to navigate on the system, or they are also finding resources on what is available like in Maine? Because some CHWs just get stuck, especially when they are first hired, on where to access certain resources.
Thank you so much, Amda, for your question. The first thing, we work in partner with MCT for core competency training, but during our monthly meeting, right now we set up the system that each week or each monthly meeting, we invite someone who just talk about specific subject that CHW already underline or want to understand. But during our peer-to-peer support, it's there as a CHW because it's only for CHW. We share that all resource we do have. And I try here to highlight something. If you are like located in Great Portland area, there we have our regional partner who is Alignment, who just share more resource about that, but we work in partner with Alignment. I think Nelida is a president and founder of Alignment. I think if you are in Greatport area, that is a good reference. But if you are in North, did not living in Greatport area, you could just contact me CHW. We have organization who could work close of your area and could provide you more information about what you need, the resource you need, opportunity you need, training, and webinar.
Great. So I think we should keep things moving here. It does look like there was a question posted by Krissa in the chat just regarding the apprenticeship program. So I think I will let Valerie and others kind of follow up around that piece. One quick thing I did also just want to plug in the chat. Axel had briefly mentioned that the Maine CHW Summit is also happening this year on April 23rd. So I did include a link in there just to for people to find out more information about that event as well. That's upcoming, just kind of highlighting their work around that piece. But let's transition over now to our final group of presenters. We are going to have Leslie Lorenzen and Emily Ferry from Maine Primary Care Association, who are going to provide an overview of their efforts to support CHWs within FQHCs in state. So I will hand it over to them.
Great, thanks, Ben. Hello, everyone. My name is Leslie Lorenzen. My pronouns are she, her, and I'm the Workforce Program Manager for the Maine Primary Care Association. We are here today to share with you the ways that MPCA provides supports for CHWs who work in federally qualified health centers. In the next few moments, we will share about our organization, what an FQHC is, and the supportive frameworks we offer to help support CHWs who work in FQHCs. Next. But first, I would like to introduce the other members of MPCA's workforce team. Joining me today is Emily Ferry, the Director of Workforce Initiatives, and Lisa Tappert, who is a consultant that supports our team and also facilitates our CHW peer group. The Maine Primary Care Association is a membership organization representing Maine's community health centers, serving 1 in 6 Mainers with primary and preventive healthcare services. With over 40 years of experience, MPCA provides technical assistance, training, and advocacy to strengthen the healthcare safety net. Rooted in values of strategy, innovation, quality, and collaboration, MPCA fosters partnerships and initiatives to improve healthcare quality and accessibility statewide. The map shown reflects the health centers across Maine, which is home to 20 health centers and over 20 site locations covering all 16 counties. Federally qualified health centers are nonprofit, patient-governed organizations that are partially funded by the federal government through HRSA. They play a crucial role in addressing healthcare disparities in medically underserved areas or populations. FQHCs are dedicated to fostering health equity and delivering high-quality, comprehensive primary health care to all individuals, regardless of insurance status or ability to pay, while also integrating holistic care and supportive services that include education, transition, and transportation. Unique in their structure, FQHCs operate under specific regulations distinct from other primary care practices. They integrate a range of services, including behavioral health, dental, pharmacy, and enabling services to provide holistic care that addresses the diverse needs of their communities. While this slide may seem overwhelming, it's designed to underscore the vast number of services provided at Maine's health centers. I'm going to pause here to allow you to absorb the information, and please feel free to share any insights or reflections you've gathered from this slide or our presentation thus far.
All right. Hi, everyone. Like Leslie said at the onset, my name is Emily Ferry, and I'm the Director of Workforce Initiatives at MPCA. I also oversee a HRSA-funded project called the Maine Workforce Innovation Network, which brings together a group of FQHCs and training partners, including MCD Global Health, to build recruitment, training, and retention pathways for community health workers, medical assistants, and dental assistants. MPCA provides relevant training and technical assistance to community health workers employed within Maine's vast network of FQHCs, which you just saw on that last slide of the map that Leslie shared. As Leslie reviewed, FQHCs provide comprehensive primary care, dental, behavioral health, and many other services to their communities, most of whom are in Maine's most rural locations. CHWs are really important members of an FQHC care team, and we wanted to touch briefly on the role that CHWs may have within an FQHC. So as listed here, CHWs may work directly for a health center as a part-time or full-time employee. CHWs are often the bridge to care to FQHCs, especially those in very rural communities, as I mentioned before. They often screen for social drivers of health and connect patients to a health center or community resources. There are some specialized programs or roles CHWs may perform in FQHCs, or specifically those that work in primary care. For example, they might support clinical staff inside and outside the health center, whether that's assisting with social determinants of health referrals or performing home visits. They may assist with documentation in an electronic medical record to ensure closing of referral loops. They support disease management, such as diabetes prevention and education and other chronic disease prevention programming. Some CHWs may support behavioral health programming, such as access to medication-assisted treatment within a health center. And then also, a CHW may work at a school-based health center location to work to connect children to services. For example, we know of a school-based health center location where there's a CHW working where they lost a behavioral health provider. So the CHW that's working there is connecting students to telehealth services to connect with a mental health provider via telehealth. All right, with the funding support of the program I mentioned before, the Maine Workforce Innovation Network program, MPCA continues to build resources and supports for CHWs in the network. Another project that has informed these supports is a research project that MPCA led, funded by the Maine Health Access Foundation. We had the really unique, awesome opportunity to visit and interview 8 FQHCs to talk with CHWs and other staff to understand how CHWs were being integrated into their workforce. And from these interviews and other conversations, we've built or are continuously building supports around some of the topics that are listed here on this slide. So we are providing support to leadership by sharing operational successes and assisting with overcoming barriers as FQHCs are implementing a CHW program. We assess and support workflows such as social drivers of health screening and use of the Prepare tool, or charting in an EMR and closing referral loops. We're also helping CHWs and other staff understand the way CHWs work, how CHW work is classified, which can be reported in the UDS, which is a health center specific reporting system. We assist health centers who have interest in developing a home visit program. And then we also provide supervision support. So we certainly refer folks to the CHW supervision training by MCD Global Health, but then MPCA also offers additional FQHC manager and supervisor trainings for new and advanced leaders. So this slide reflects the ways in which MPCA delivers content and supports to CHWs and their team. MPCA hosts a convening of CHWs and supervisors each month to come together to share best practices, challenges, and helpful resources with one another. This is a space where we are beginning to deliver more content, which I'll share some of the training topics on the next slide. There are a lot of really valuable CHW focus meetings that are happening throughout the state, which we've heard on this call. But we also wanted to have a space where we could work with our member CHWs and other CHWs working in primary care. We've also been developing a CHW resource library and also send out relevant resources and trainings twice a month. And then funding through the Maine Workforce Innovation program supports identified training topics, career development opportunities for CHWs interested in developing more clinical skills like cross-training as a medical assistant or a dental assistant. And then we also provide technical assistance for any questions that arise from CHWs. And we also serve as a connector to CHWs in our network for peer resource sharing. So as I mentioned, MPCA's CHW peer call has been a space where we've done a lot of surveying, and we've heard from CHWs on that call around training topics of interest. So here are some of the training topics CHWs highlighted from discussion as interest for this year. So these are a list of training topics that we'll be rolling out over the next year. And I want to just take a pause for a minute. One of the training topics listed here is chronic disease management. And I just wanted to allow for Lisa Tappert to come off mute and speak to this specific topic.
Thanks, Emily. I also want to go back to one point that Emily made and say that community health worker programs in Maine are new to most of the practices that are starting to employ them. And what we're really finding is there is a need for health center practice managers to understand how to start programs, how to assess programs as they're midway through, how to learn from each other from like-minded programs. And so that's really something that we've been trying to move forward with at this stage in PCPlus, is to really bring people together to share best practices, because this is a huge undertaking for people to start CHW programming. As Emily said, one of the areas for CHWs that we've seen in FQHCs, in addition to the sort of classic screening for SDOH and providing resources to community resources to patients, is some specialization, CHW specialization. We're going to talk about that during the summit a little bit more. But one of these areas is CHWs who are sort of solely focused on chronic disease management. And so MCD, our amazing partners, have such good training materials, and there are chronic disease management trainings available through MCD's program. And because many of the CHWs and FQHC practices are kind of generalists, we do want to mention that sometimes a CHW will be very involved in diabetes programming, like through the state, the Maine CDC program that is a disease-specific program, where CHW may spend all of their time working to move the needle on control of diabetes in a community for a number of folks that really need that help. And so working with diabetes, working with asthma, those kinds of things, whether it's somebody who is a peer support worker who also has a CHW training to do opioid use disorder assistance, these are all folks that are kind of specialized. And I think we're going to be seeing more and more of that as we move forward. So that's all I'll say about that.
Thanks, Lisa. That's it for our presentation. Thank you so much for giving us the space to share the work that we're doing and the amazing work that FQHCs are doing in their communities. I'm just going to pause for a moment to see if there are any questions. And then this slide also reflects my contact information as well as Leslie's if you'd like to reach out at any point after this webinar.
Great. So we'll open it up to see if there are any questions for Emily, Leslie, and Lisa. I do see one, I think, raised by Melinda Thomas just in the chat. Do you know how many FQHCs have CHWs that can make home visits?
Go ahead, Lisa. I saw you come off mute.
There are some FQHCs that have been doing home visits for a long time, and there are some that are just starting. So it really runs the gamut. I would say that there are not too many who are doing home visits. Primarily, we see CHWs involved in meeting patients outside in the community, but not necessarily yet visiting their homes. And so putting protocols into place and safety measures, all of that is important.
Any other questions that folks would like to pose? Okay. Well, we'll keep things moving here. Again, thank you to all three of our presenter groups. This has been really great in-depth information. If folks do have additional questions, feel free to pop those into the chat. But I think we will transition back into a kind of final recap of a few additional resources that we wanted to highlight for people before we kind of move into the final portion of the webinar. So one of the first things we wanted to point to is to make people aware of is that the Office of Population Health Equity at Maine CDC, well, one, they've been doing really a lot of grant funding work with community health workers over the last several years. But one of the programs we wanted to draw people's attention to is the Community Care Program, which is a referral system that links individuals to many different types of community organizations across the state, some of which that employ CHWs. So if Eden or Hamda is on the call at the moment, or Grace, I was curious, would one of you be willing to provide just a quick, maybe 1 minute kind of synopsis of the Community Care Program for our partners here on the call?
Hi, Ben. Sure, I would be happy to. And while I'm talking, I can drop a link in the chat to the referral form so people can kind of check it out if they're interested. But essentially, you said it. The Community Care Program is a program that operates what we call the Community Care Referral System. It operates out of the Office of Population Health Equity within the Maine CDC. And essentially, it's an online referral form that is intended to support individuals across the state who are experiencing barriers to care and access to care related to social service supports. Through the referral system, an individual can submit a referral either for themselves or for others to get connected with one or more community organizations who can help support a variety of social service related needs. A couple things that I'll kind of point out just about the referral system itself is that our network of organizations who kind of partner with us through the referral system and who ultimately receive referrals and provide the supports for the needs expressed in referrals exist all across the state. It's safe to say that we do have kind of a stronger network in both Cumberland and Androscoggin counties. And as time goes on, we're very interested in continuing to expand into other counties in the state and kind of broaden our presence there. I'd also like to note that if you were to click on the link that I shared in the chat, you'll see kind of in the introductory text of the form that we note that the referral system is designed so that when we receive a referral, we forward it on to, again, one or more community organizations who can meet the needs expressed in the referral. And then we have an expressed turnaround time of 1 to 3 days by which the organization who we forward the referral on will then turn around and connect with the person seeking services. I want to emphasize that that 1 to 3 day turnaround time can vary. We are working kind of with the good graces of the organizations we partner with and who also may be kind of navigating their own wait lists for service and own capacity constraints. So just kind of noting those little intricacies about the referral system. But essentially, to kind of wrap up this little explanation, as Ben said, the community care referral system functions as a pretty low barrier online referral system that anyone can use to submit a referral for someone who needs some supports related to social determinants of health. I don't want to spend too much of the time today, so I'm going to go ahead and just drop my email address as well as an email address that anyone can use to reach myself or Hamda Ahmed or Grace Tezo, who I believe are both also on this call and who work as community care navigators, really doing the bulk of the on the grounds work of accepting referrals and then forwarding them along to organizations who can meet the needs expressed in those referrals. So again, I will drop my contact information and our shared email address in the chat. If you're interested in learning more or connecting with us on a call, please reach out. We would be more than happy to connect and kind of talk a bit more about our system. So thanks for the opportunity, Ben. Appreciate it.
Great. The next resource we have listed on the slide here is the City of Portland that has a health equity alignment project, which brings together organizations in Cumberland County to collaborate on initiatives related to population health. And it is worth mentioning that the alignment is starting a CHW committee. And Nalita, if you're on the call, I'd love to invite you to also provide maybe a quick, kind of 1-minute synopsis of that work that's going on as well.
Hi, it's Skylar Bergeron. I think Nalita had to move on to another meeting, but I can give a super brief overview.
Sounds great. Thank you, Skylar.
Yeah, sure. So the Portland Health Equity Alignment is basically a coalition of several different organizations and community members working together towards achieving population health equity in the greater Portland area. And just provides a platform for resource sharing and collaborative work on issues related to health equity. And we recently just established a CHW committee, which has a lot of different focuses, but basically provides CHWs working in the greater Portland area opportunities to share resources, collaborate, work within their organizations and other organizations to kind of increase community and clinical linkages. And I just want to emphasize that for our purposes, Greater Portland includes Portland, South Portland, Gorham, Wyndham, and Westbrook. So right now, that's the area that we're focusing on. Maybe we might be able to expand in the future. Basically working on kind of all different aspects of CHW work, whether that's advocacy, but also peer support within the CHW network, and just providing kind of a space for CHWs working in Portland to connect, because we felt that was a gap that we needed to fill. Ben, I don't know if it's okay, I'll put our webpage in the chat, a link to that, which there's a button to sign up for notifications, and then my email is also linked at the bottom of that page for anyone who wants to find out more information or sign up for notifications from the site.
That sounds great. Thank you so much, Skylar, for providing that overview and also posting that information to the chat. So, and then the third thing that we wanted to draw people's attention to as well, I think I mentioned this earlier on the call today, is that this Thursday at 12 p.m., the Maine CHW Initiative and the Maine Area Health Education Center at UNE will be hosting a 1-hour webinar on engaging CHWs within healthcare teams. So I'd encourage you all to check that out. There's a link provided in the slide for the registration for that event. There's also a webinar, or the webinar that we're doing today obviously is focused on Maine Care, but it's worth mentioning that there's been a lot of movement within Medicare over the last year around reimbursing CHWs through several new codes. So I've also included a link to a webinar on demand that was developed by the Partnership to Align Social Care that provides a lot of great in-depth information on CHWs within Medicare that I would encourage folks to take a look at. There's a link provided for to register to be able to access that recording. And then finally, we've also included a form on this slide that participants can use to request additional information regarding Primary Care Plus, and I'll let Loretta provide a little bit more information about that as well.
Yeah, great, Ben. Thank you. So this is just an opportunity for you all to let us know what the needs are in terms of whether you'd be interested in hearing more about Primary Care Plus or community health workers. It really gives us an opportunity to see what the need is and to look at where more learning opportunities or technical assistance is needed. So this is included as a link here. And this will be shared after the presentation today, the whole presentation. Thank you.
Great. Well, thank you, everybody. I will turn it back over to Olivia at this point to lead us through the final section of the webinar. I'll also say that we did our best to try to include as many resources as possible today, but I'm sure there are some that we might have missed in terms of other initiatives that are going on in state. So I would also encourage people to, add information about other things that you feel like participants would benefit from in the chat. And there will also be a discussion section next, which will provide an opportunity for people to talk more about that as well. So I'll hand it over to Olivia.
Great. Yes. So we're going to hand over the time to you all to have a small group discussion if we go to the next slide. So what we want to do what Ben just said, what do you want to hear more about? What do you know that wasn't presented today that you think should be shared? Just a topic of what are you thinking about some of your things that surprised you today that you didn't know what's going on and you're excited to learn more about. So really just reflecting on today and also sharing additional information, getting back to some of the questions maybe you know more about how interpreter services are accessed for people without main care or they're not accessing a main care service. So general conversation, we're not going to ask the groups to report back out. Instead, we're going to ask though that you put some key ideas back in this main room group chat when you get back, because it helps this planning group know what else to add or feature in the future. And the groups will be random, and about 8 people will do about 8 to 10 minutes, and then we'll see you back here for just a few more closing remarks. We'll end a little bit early. So we'll send everyone off and see you soon back in the room. Thank you.
Yes, I'll be getting a list of all the registrants for the webinar today, and I'll be sending an email out with the slide attachment.
Oh, even better. Okay, great. And we'll also post the recording though on the department's YouTube page, and we can send an e-message out, I think, about the posting as well. But you'll get quick access if you register, so that's great for you all. So as I mentioned, it would be great we're not going to do report outs in a group setting, but I think my group at least had a really great discussion. If you could put your ideas, main takeaways, asks, things you wanted to share in the chat, we're going to copy and paste the chat when this is done. So we'll look at them all later. So it can be a flurry of just posts. We're not going to ask you to speak to them. Helps us understand what the conversations were like and where we could go next. So that would be great if you could all do that. And then we're just going to do 2 more quick things. So when we were talking internally, even the question of how do I even start this conversation with a partner, whether the partner be the primary care practice or the community-based organization, the local health department, the other organization, how do you even make the first connection? So we're going to do 2 quick polls. One is, the first one's for primary care practices. So we'll launch that poll. If you're working at a primary care practice, or you used to, how do you suggest a CHW, a community-based organization, another organization that employs CHWs, how would they even best reach out to you to see if you could partner in this work? You could, oh, there we go. Only answer this one if you actually work at a primary care practice.
They're actually both launched at the same time, so just answer the one that applies to you.
Perfect, look at that. So then the second question is, if you work at a community-based organization, local public health, or you yourself are a CHW, how would someone reach out to you? All right, I'll just end this and we'll share the results. All right, is everyone seeing the results? Yeah. Okay, so both overwhelmingly email the general email box or practice manager or call the front desk. There's some places where you could walk in during business hours, but primarily email or call. So that's good. If anyone's looking for a first step, you heard it here. You can email or call. All right, and then the last thing, we're going to close out essentially with some open text boxes popping up on your screen. What would be helpful for PCPlus practices for additional support? What would be helpful for CBOs, health departments, others for additional support? And then what next steps will you be taking after today? So we've had a few exchanges and conversations. Maybe you're going to watch one of the webinars that was linked here. Maybe you're going to download the community care program referral form and contact Eden and others at the Office of Population Health Equity to learn more about what that is. The CHW supervision training is coming up in April, I just learned. So the next cohort of CHW supervision training is in April through MCD. You could think about signing up a person in your practice for that training. So interested in people reflecting on that before you leave today, and then we are going to end at this point. We'll continue to share information with the main care e-message listserv that you use to sign up for this webinar, and we will still be available via your general ways to connect with main care PC, our primary care email, which I'll have to put in the chat for that as well. So thank you so much for joining today. This has been really helpful. Again, there's so much going on that I always want, whenever I talk to someone about this, I feel like, oh, but there's this and there's also this, and you could do any of these things to make this work for your local organization or your practice. And I think the team today did a great job highlighting a lot of different things. So hopefully you feel like you do have a next step, and we will reach out to you some more with some additional resources and support as we get closer to April, when this requirement officially kicks in for Primary Care Plus, and also going forward, because again, we're going to be refining this model, building out the supports for these partnerships and the community health worker workforce as we go into the rest of 2024 and for many years after that. So thank you so much, and we'll talk to you later.
And I'll be staying on, so if you want some more time to answer these polls, please don't feel you need to rush.
Thanks so much, Angelica. And you'll be able to export the chat and everything once everyone's finished entering.
I will.
Perfect. Thank you so much, everyone. Thank you, Angelica, for running the show today. I'm going to sign off and we'll talk a little bit later.
Sounds great. Thank you, folks. Bye-bye.
Bye.
Bye.
All right, thank you. Bye.